Welcome to Bullet Point Nursing. My name is Dr. Goldstein. Let's get started. Today we are looking at mental status assessment and specifically the Glasgow Coma score. You are likely already familiar with the ABCs of patient assessment, which is the airway, breathing, and circulation. The next step after that is D, which is disability, which includes the neurological exam. One of the most common tools used for a neurological exam is the Glasgow Coma scale. This is commonly referred to as a GCS, and it assesses the patient's mental status and mental functioning. The higher the score, the better the patient is doing. A perfect score is 15, and the lowest score is a 3. The GCS assesses 3 distinct categories to determine the patient's overall mental status. These 3 categories are their response to eye opening, their verbal response, and their motor response. If the patient receives the lowest score in each of these 3 categories, that would be a 3, and that would obviously be scoring a 1, which is the lowest score in each of the 3 categories. If the patient scores a maximum of a 15, then obviously they scored full points in every section. However, if a patient scores any number between 3 and 15, we must provide a detailed breakdown of what the patient's score was. Simply saying the patient's GCS is a 12 does not give the upcoming provider or the next provider information on how you got to that 12. Where were their deficits? GCS is commonly used in neurological units as well as in trauma, and we often use it by assessing a patient's baseline mental status and then ongoing assessments to identify is the patient maintaining their current mental status or if it's improving or declining. In TBI or traumatic brain injury, the GCS is heavily used, and this is just one example of the use of the GCS. And in this case, patients are considered to have a severe TBI if they have a GCS of 8 or less. Let's look at the actual breakdown of the GCS. The first component is eye opening, and it's scored from a 4 to a 1. A 4 is the patient's eyes spontaneously open. If the patient's eyes are not spontaneously open and looking around at what is going on, we move down to the next option. We see if the patient opens their eyes to verbal commands. So we call out, hey, can you tell me your name? Can you open your eyes? If the patient is then able to open their eyes, but unable to maintain their level of alertness, they would earn a 3, which is responsive to verbal only. If upon alerting them with verbal commands to open their eyes, they then keep their eyes spontaneously open, that does bump them up to a 4. If they do not have their eyes spontaneously open and calling out to them to open their eyes still does not get them to open their eyes, we move down to painful stimuli. There are several options here for what stimuli to provide in any event. If the patient then opens their eyes to painful stimuli, we give them a 2. If that then keeps them awake and they're able to hold that level of alertness, they go back up to the 4. However, in most cases, if they are only responsive to painful stimuli, that will not be long-lived and that will keep them at a 2. If even with painful stimuli, the patient does not open their eyes, then we give them a 1 for no eye opening. The next category that we look at is verbal response. And this one is scored from a 5 being the highest score to again a 1 being the lowest score. A 5 is where the patient is oriented to person, place, time, and if you use the 4th criteria, event, depending whether you do A&O times 3 or A&O times 4. The patient would be deducted 1 point if they are confused. If you ask them where they are and they said blue, that would be confused, but that could also be the next line, which is inappropriate. And these can easily be determined differently based on the provider. So if a patient in that example, you ask where they are and they tell you the wrong location, most would consider that confused. However, if you ask them where they are and they tell you blue, most would consider that to be inappropriate. It is important for this reason that you document exactly how you came to that conclusion, because with the same response, one provider may document that as a 4 for confused, And another professional may document that as a 3 for inappropriate. Moving down, we have incomprehensible. So you ask a patient a question and you only get a mumbled response that is incomprehensible. This would be a score of a 2, and no verbal response would be a score of a 1. Please keep in mind, if a patient is, for example, nonverbal, they had a issue with their larynx or their vocal cords and they are not able to speak, but they're able to fully communicate and through writing and able to answer all questions, that would get them a response of they are nonverbal, and that would negate this section of the assessment. We would not give them full points. We would not give them deducted points. We would say that we're unable to assess their verbal response. Next, we have motor response, and a motor response is ranked from 6 being the highest and 1 being no response at all. In a 6, the patient is able to follow commands. So if you ask them to lift their arm, they're able to do so. If they're not able to do so, then we move down to the next item. The next item is we provide painful stimulation and we see the patient's response. If they're able to localize the pain, meaning they are able to take action against it, for example, if the provider is doing a sternal rub and the patient uses their own arm to push the provider's hand away, that would be localizing pain. That means the brain is able to identify where the pain is and take action against it. That would be a score of a 5. If the patient is not able to do that, but they're able to withdraw from the pain, they're able to cringe at it, that would be withdraws from pain, and that would be a 4. A 3 and a 2 are related to posturing. In decorticate posturing, and this is best observed by Googling decorticate and decerebrate posturing. Decorticate posturing, the patient would get a 3, and decerebrate posturing, the patient would get a 2. And if you're looking at a picture of what these are, that would be simple to understand because in decorticate posturing, the patient is still protecting their core. In decerebrate posturing, they can't even do that. So that is a lower level of mental processing. Finally, if you provide painful stimulation and you have no motor response, that would be a 1. Remember, for each of these, you can have 2 people get 2 different objective answers. So be sure for that reason to just always document how you came to that conclusion so that everyone knows what the patient's assessment was exactly for you so that they can compare it to what their assessment is at this particular time. Thank you for watching. Have a great day.